we start, I would like to ask your help to hit the like button, hit the subscribe, and smash the bell. Smash like hawk.
Hello, good evening, everyone. Okay, please mute yourself. Okay, now we are waiting for the physiotherapist and our dietitian. All right, I think there's a bit of miscommunication. I asked them to go to the website and click on the Zoom link, and I think they did not get it. All right, so I'm going to forward them the Zoom link itself and see whether they got it. Okay. Let him give them some time to start the video, and we start with.
Can already.
It's okay.
Can already.
Just
Okay.
follow the schedule.
Okay, can. Okay, then Sim, you can start first. All right. So first off,
Okay.
I'd like to thank everyone for coming. Okay. And today we have invited Mr. Sim Yonglong, a physiotherapist from Sim Physiotherapy. He attained his bachelor degree in Utah, previously based in one of the private hospitals specialized in cardio and acute rehab. Today, he's going to answer a few questions, okay, about physiotherapies in pregnancy. Okay, so first off, we're gonna ask him, okay, why pregnant ladies have low back pain?
Okay, for this, I would like to show you guys two pictures. Okay, so Dr. Lo, can you please put me into a host?
Pause, wait.
Because I am unable to share the screen.
Okay. Oh, I don't know how to make to host. Wait,
But if don't know also.
never mind. You just explain first and see how.
Okay, so I will use myself as a model.
Okay.
So you guys can see my pelvis here, my bone.
Okay.
Okay. So for normal posture, normally our pelvis must be a bit slightly anterior or tilt to the front. Okay. But for late pregnancy women, their pelvis will be tilt a bit tilt more to the front. Okay. And this what really causes it is because when your abdominals is getting bigger, your baby is getting bigger, so it will stretch against your core muscle here. Okay, so when it stretch your core muscle will getting weaker. In other words, your back muscle will getting stronger. Okay, so because of this, it will change your pelvic tilt to the front. And not to forget, your abdominals, your baby will be getting heavier and heavier. So that's why your back muscle will have to bear more weight. Okay. So because of this, try to imagine when you already have to work 24 hours, but now I give you more work. So what will you feel? More stress. Same goes to your muscle. You will feel fatigue and feel pain. Okay.
All right. So the second question is, what are the top 3 exercises to reduce back pain?
Okay, so to prevent this, ladies must always remember, okay, not to tilt too much your pelvis to the front. Okay, so later I will introduce 3 exercises, which is help you to mobilize your lower back muscle, lower back spine, as well as your pelvis. Okay. And also it will help you to strengthen your core muscle. Okay, so to correct the posture. So for the first exercise, I will suggest you do on top. Can you see my bed here? Can?
Yep, can.
Is it clear? Can see? Can?
Yes.
Okay, so I will suggest you do at the floor on a flat surface. Okay, but so this is a bed lah. So but I will suggest you ladies do on the floor with the yoga mat. Okay, so first cat and camel exercise, it consists of 2 steps. Okay, so starting position, legs kneeling, and try to lift 1 feet distance. Okay, and put both your shoulders, put both your hands under your shoulders. Okay, so that you can feel more stable and will not harm your shoulder. Okay, so for the cat posture, legs are head look up. Okay, and try to dip down your lower back. Okay, like this. Okay, so you will feel a contraction over your back muscle. Okay, so for the camel posture, try to look down and try to curve up like this. Okay, but for a late pregnancy woman, they will feel a bit hard to curve up because of the weak core muscle. So if you guys can flatten your back around like this is good enough already. Okay, so each posture, cat posture, you can try to hold 5 to 10 seconds. And when you change to the other posture, also same, 5 to 10 seconds. Okay, so these two posture you can repeat about 10 times. Okay, so this is the first exercise to mobilize your spine and also strengthen your core and back muscle. Okay, so for the second exercise, we will do it in lying position. Okay, so make sure you side lying first before you facing up. Okay, can see me?
Yep, can.
Can. Okay, so your leg must be, leave it like 45 degree. Okay, bend your knee 45 degree around like this. Okay, make sure your knees is apart. Okay, so put one of your hand behind your lower back and the other hand put on top of your core muscle or on your tummy. Okay, so if you're ready in this position, try to push your lower back against your hand under your lower back. Okay, push your lower back so you can feel the contraction over your core muscle. Okay, so in this position or in this posture, you can try to hold for 5 to 10 seconds again. Okay, if after 5 seconds you can try to relax. Okay, if you don't know how to relax, you can just scroll your body downwards and you can feel your bone is tilting to the front. And when you push down, press your lower back on your hand, you will feel the contraction over your core muscle. So in these two steps, you can feel your pelvis is mobilized to the front and to the back. Okay, so this is the second exercise. Again, this exercise you can hold for 10 seconds, you repeat 10 times. Okay, so for the third exercise, this time same posture but stick together your knee. Okay, so you just need to tilt or turn your knee down. Okay, maybe to one side first, and you will, when you're already starting to feel the stretch over your lower back, you just hold there. Okay, make sure you feel the stretch but not pain. Okay, so hold like that around 3 seconds and change to the other side. Okay, so you can do this side by side around 20 or 30 times. Okay, this to mobilize your pelvis and your lower back spine again. Okay, so these three exercises you guys can do it in morning, afternoon, and night.
Okay, so the third question is, what are the correct ways for pregnant ladies to move from lying to sitting to standing?
Okay, lying from sitting to standing. Okay, it's just the balik what I do just now, huh?
Alright.
So many people will just get out like this, right? Am I right?
Yeah.
But actually, it's not good. It's not good for the core muscle as well as the back muscle, especially when you're having a lower back pain. So remember, turning first. Turn to the side first. Okay, use your upper hand to push yourself, assist you push yourself up. Okay, when you want to stand up, use your hand to help you and try to bend a bit forward. Okay, before you stand up.
Yeah.
Okay.
Okay. So the next question is, how do I, not me, okay? How do pregnant ladies perform pelvis floor exercise to prevent uterine prolapse in the future?
Okay, so these okay, pelvic floor exercise like just now Dr. Low have said, is to prevent the prolapse. Besides that, it also can help to prevent the urge incontinence in future. Okay, so the feeling is like the private region muscle in drawing in sucking in. Okay, so if you want to really feel the muscle contraction, you can put both hands over the region here. Can you see me? So it's just under your umbilical cord, the region under your umbilical region. Sorry, okay, around here lah. So the contraction is like when you try to how to say, tahan or try to hold your bladder before you pee, or hold your gas lah. So you try to do together if everyone can. Okay, just put your hand both here and try to tahan the pee or tahan the gas. So you can feel the part that you're touching will be harder, feel hard. Okay, so this is a feeling of the pelvic floor muscle strengthening exercise, and you can try to like contract it, hold around like 10 seconds before you release, and try to contract again and repeat 10 times. If you're able to do that, maybe you can try to do fast another way, which is a fast way, which is contract, relax, contract, relax, contract 1 second, relax 1 second, around 10 times again. Yeah.
Sorry. Okay. Hi. Can you hear? All right. So the last question is, if the moms, some of them they are still working. So is there any office suitable exercise to reduce back pain?
Yes, of course.
Okay.
Yeah. So I will introduce 2 exercises. Okay.
All right.
So I will adjust my.
Okay.
Yeah.
All right.
Can you see my office chair?
Okay.
Okay.
Nice office chair.
So
I don't think we have back pain with this office chair.
Okay. So this I will call it as modified cat and camel exercise. Okay.
All right.
So this you can do it in sitting law. Okay. Very
So
nice, right?
Sitting cat and camel.
Sitting.
All right.
Yeah. Try to sit upright. Make sure you are not lying against the backrest, but try to sit near to the backrest.
Okay.
Can you see me?
Around one palm size.
So, around like 1 hand distance.
Okay.
Okay. So for the cat posture, look to the front and try to sit upright. So you can feel the contraction over your lower back lah. So for the camel posture, try to look down and try to curve your spine. Okay? Until your spine is touching against the backrest, right? Try to push more so you can feel more stretch. So at this time, you can feel the contraction over your core muscle. Okay. So try to hold for 10 seconds. Only change to the cat posture again. So again, this you can do like 10 times. Okay. Okay.
All right.
Yeah. So for the second exercise, I will introduce calf stretching exercise. Okay. Because I know many women will have the cramping pain, right? So you can cross your leg like this. Okay. Can you see me?
Are you okay? All right. Okay.
Yeah. Okay. Like this. Sorry, on my bottle.
Okay. Yeah.
Okay. Like this, and try to push up.
Yep.
Push up your forefoot. Okay. Until the moment you feel stretch over your core muscle.
For those who have calf, always have this pain, they can do this, okay? Or they have sprain.
Yes, like cramping pain.
Cramping,
yes.
cramp.
Yes. So you can stretch this until your stretch is released, relieved now, or you can stretch like 30 seconds and repeat 2 times. Or I will consider some people unable to cross like that. So maybe they can do it over the table edge, like this. Can you see me?
Yep.
Put like that. Yeah. Try to push against the table edge long. Okay. After that, you just try to scroll to the front until the movement you feel the stretch over your over your calf muscle. Then just hold there for 30 seconds and repeat 2 times.
Yep.
Yeah.
Okay. So my usual advice for pregnant ladies are all this stretch to prevent cramp, and usually I would tell them you need to do this like 1 or 2 hours before. It's like you will have every time cramp at night at 10 o'clock, you do it after dinner. So don't wait until the cramp comes, only you start doing the stretching.
Yes.
Right.
It's some sort of like preventions lah.
Yeah. Okay, let's see. All right, so now we are open to Q&A for Sim. Any question for Sim? You all can type in the chat box. Anyone? Oh, everyone busy doing the exercise. No question, I think.
Can ask me to repeat again one?
Okay.
No lah, no lah.
Maybe you just stay around, just in case you have question after the Miss Ho session. Then you can come back and answer us. Okay. I already made you a host, and I don't know how to unhost you. Can you make Miss Ho a host now?
Huh?
Anyway, okay. You just click on Miss Ho's picture and put there make host or something like that. I don't know.
Just hold on. Let me see.
Right.
Make host. Yes.
Make Miss Ho. Okay. All right. Okay. So all right. Great job. Very good exercise. All right. So the second okay, this is like Avenger that assemble 3 people. Okay, the second Avenger that I want to bring out is Miss Ho. Okay, Ho Chiou Yi, a clinical dietitian. She's a bachelor degree in UKM and master in UPM. Okay, currently working in Institute Kanser Negara. Okay, but her main love of her life is baking and eating. Okay, all right. So basically for diet, actually every time when I see pregnant lady, I give very simple diet advice. Basically, it's like try to avoid coffee, tea, cigarette, alcohol, and also this uncooked meat okay. And then usually I advise more carbs and less protein and less carbs, more protein and veggie and these fruits. Okay. So now Miss Ho will tell us more about this nutrition in pregnancy in 5 questions. Okay, Miss Ho, are you ready?
Yeah.
Okay.
So,
okay.
shall we?
Okay. So I shall ask the first question. The usual question is, do I gain too much weight not me lah. Okay. Do the pregnant lady gain too much weight in pregnancy?
So before we consider is it how much should I gain, or is it I gain too much? Actually, we have to check back the BMI before pregnant. Before we get the morning sickness, the usual BMI. If you are underweight, the appropriate weight gain will be 12 to 18 kg. If you are normal, 11 to 16 and so on. Okay. So you have to make sure your BMI first before pregnancy, but not BMI during the morning sickness. Usually the first trimester will be having some morning sickness and then weight loss. But just before pregnant, you can check back. Okay.
From ONG, usually for us, we don't allow any weight loss. If it's weight loss, it's considered abnormal. But if it's static throughout pregnancy, it's still normal. And then for me, usually for patient, I would say my threshold is a bit high. 1 month or 4 weeks don't gain more than 2 kilo. All right. So the second question for Miss Ho is, when you are pregnant, are you eating for 1 or for 2?
Yeah, usually, I think no. Regardless is Chinese, Malay, or India, or any races, we might thought I have to eat more to support 2 people, including the growth of baby, infant, and then some patient or some mothers will eat double. Okay. To get but actually that is not true. Okay. Usually we divide into 3 trimester. For first trimester, actually doesn't increase much our energy requirement. If really what we want to calculate is about 102 kilocal only for first trimester, means until 3rd month. Then second trimester will be increased by 360 cal, means equivalent with 1 cup of milk with 1 kway teow soup extra.
Oh, you mean the whole day, one cup of milk, 1 kway teow soup?
Increase.
Oh, increase. Additional.
Okay. The usual diet we additional. Yeah.
So it's not it's not like eating for 2. It's like when your second trimester, you eat for 1 person plus 1 cup of milk and 1 kway teow soup.
Yeah, that is
alright.
At least we can imagine.
Okay.
So for the 3rd trimester will be a little bit more,
Okay.
If we want to have the exact figure, will be 480. Usually we
Okay.
round out to 500.
Okay.
So means you can eat one dinner more during the
One dinner.
last
Wow, it
trimester,
sounds-
but depends on your how much
Weighting.
the weight you have gained,
Okay.
and is it you have 3DM or not.
Okay. All right.
It will impact your energy and protein requirement.
And how about
usually
how- how about the composition? Like what I said, less carbs, all these things.
yeah, so we go to next. Usually
Oh,
we
okay.
will ask the patient
Yep.
to make it easier to
Mhm.
ikut the suku-suku separuh.
Okay.
Actually, just like Dr. Low mentioned, we
Okay.
aim for high protein
Yep.
to tackle the protein requirement and to target to hit the iron intake. Usually,
Alright.
the pregnant mother will having a low HB.
Yep. Hemoglobin.
Yeah, so
Red cells are
when we
lower. Mhm.
red blood cell. When we increase the protein intake, means in your breakfast, lunch, and dinner, make sure there is protein inside there. Egg, cheese, milk, fish, pork, whatever. Okay, and lunch usually for Chinese maybe have a rice, veggie, and one fish. Usually I will ask the patient to double eat the protein. If you can finish 2 fish, go for it. Or if
Okay.
you cannot, then maybe 1 fish with 1 tauhu or 1 egg extra.
Okay.
It might help in your hemoglobin and your protein intake.
Yep. Okay.
Okay.
So it's
for
like,
the fruit,
so if the patient, if the pregnant lady eat a lot of protein, actually they have sufficient iron. So they actually, because some ladies they have this constipation when they have iron tablet, right? So if they take protein, they have sufficient iron as well, right?
it can help. But if let's say for those mommy before means the first or second trimester already low
Yeah.
HB, usually
Then
gynae will give
yes,
iron supplement.
supplements. Okay.
Yeah.
All right. So the third question I want to ask is, what are the food to eat when you have when the lady have lactose intolerance?
Yeah, some of the mommy cannot really cannot take milk. It will means diarrhea, stomach pain, or
Okay.
bloated. Okay, some mommy really had it, tak suka susu, betul. And then we might ask for those like want to try for the milk, maybe can try for the low lactose products, means cheese, yogurt. After fermentation, the lactose content will be reduced. Then some of the mommy that having lactose intolerance, she tolerate well with the ferment products, means yogurt or cheese. Okay, just like what I mentioned just now, increase the intake of fish, including some bones. Meat can help a little bit for the calcium intake. If the above 2 points cannot achieve, you might try for the soybean products.
Okay.
That is the third choice lah.
So soybean product is like tofu.
Yeah, tofu, tempeh, soy milk.
Okay. All right.
It can help. Yeah.
So the next question is, during the first 3 months, the ladies usually have morning sickness. So what are the diet that they're supposed to change?
Yeah. So most of the patients, even me, are having a very bad morning sickness. Usually we ask the patient, don't wait until you get hungry, or wait until I get hungry, I just eat. You just makan ikut, just follow your watch, just follow your clock. When size up, try to eat something.
Yeah.
Okay.
I usually will tell them eat
patient,
10 meals. 10 meals.
Yeah, 2 to 3 hourly, having something.
Okay.
Don't let your stomach to be empty.
All right.
It helps. Okay, and then if frequent, just like put the low shade, reduce the intake of fatty and fried food. Don't go for like KFC or pisang goreng. I don't think mommy will go for it during morning sickness.
Sometimes they were very gen, no? They want to eat the meat.
If let's say if so, during morning sickness, the KFC is the one that you can eat it. Then go for it.
Okay. All right.
Yeah. Avoid spicy food that increase the symptom lah. Drink plenty of water, fruit juice, do for drinking plenty of water and fruit juice is to ensure, and taking the fruit in between meal to ensure the hydration, to avoid dehydration during when you're having the morning sickness. Yeah.
Okay.
And then citrus fruit may help overcome some nausea. Some of my
Citrus
patients will
fruits
ask
means- Oh, what kind
like,
of fruits are citrus
orange,
fruits? Okay.
orange,
All right.
lemon.
All right.
Yeah, it helps. Some of my patients add the lemon in the drinking water,
Okay.
so
Okay.
that she can drink. Yeah.
Okay. So the next question is, what are the food to eat when you have heartburn and constipated in pregnancy?
For this maybe happen at the
Later part.
behind the
Yeah.
later part. Yeah,
Mm.
it's very subtle. Yeah.
Yep.
Yeah. So we try to ask a patient to eat small portion, to eat a little bit more frequent. Like Dr. Lo say 8 to 10 meal per day. The bill ask hubby to pay it. And then eat slowly. So that you can tolerate the food very well. Okay. Reduce the intake of spicy and high fat, because it will increase the inflammation of the gastric if we get the high fat and spicy. Avoid lying down immediately after eating milk. Is for heartburn. For the constipation, I think constipation might happen throughout the pregnancy, especially having the iron tablet, the iron supplement. Okay, we have to make sure and drink a lot of water, have fruit juice, fruits, take more fiber-rich meals. If pregnancy, we try to, if having the constipation, make sure maybe you can try to change your white rice to brown rice. Okay.
But brown rice, the carbs is more, right?
No, actually it's equivalent if the portion is the same.
Because I read somewhere that the carbs are more when it's a brown rice.
The
it's equivalent.
carbohydrate content, is similar.
Similar,
Yeah.
okay.
Yeah, and then be more physical active. Another point I want to add is when your body give you signal to go to toilet,
Okay.
do the big business, please go for it.
Okay.
Do it. Yeah.
All right.
Some of my patient is busy with the first or second, the toddler, and then tak boleh dah, tahan dulu. When you tahan 1 or 2 days, bye bye already. No more hint for you.
I think at the other spectrum of this tahan is some ladies, they every day have to go and pass motion. So for me, I usually advise not to do that, because it's like you don't go to toilet pee every hour, right? So you don't have to go every day unless you get feeling. Then like what you said, you have feeling on the pass motion, you must quickly go and poo. Right?
Yeah.
Okay. So all right. Then if after the diet control still constipated, then usually I will give some medication. All right. So
and then if you push it, it will become hemorrhoid already.
Yes. Hemorrhoid, and when you get old, you have prolapse as well. No exercise can help you there. All right.
Yeah.
So Miss Ho, we got one question from Miss Ho Chiou Yi. Will soda water help the nausea or gassy stomach?
Soda water, actually there is two opinion.
Okay.
One is when we drinking the soda water, inside the soda water there is a carbon dioxide inside that.
All right.
It will increase the pressure of gas in your stomach.
Okay.
When some of the patient gassy, want to burp but cannot burp it.
Okay.
Then they try to drink like gassy or soft drink to help it burp. Actually, quite risky. Sometimes it won't help. It will make the symptom more worse. What I encourage is, if let's say like nausea or gassy, you can try to have like ginger honey water. It might help. Or during you want to burp, you try to change your position. I think physio will be better in this term. From the sitting side to stand out, and then because the pressure, it will help you to burp. Yeah.
Okay. All right. So I think there is no question. All right, maybe they are still thinking what to ask you.
Okay.
All right. Okay. So thank you, Miss Ho, for the wonderful sharing.
Thank you.
All right.
Thank you.
So do you mind just wait for a while and see whether there's any question come along?
Sure.
It's another
No problem.
15 minutes. All right. Okay, so my my free Zoom version is going to expire in 2 minutes time. So we'll take a very short, maybe 1 minute break. I will just y'all don't log out. Y'all just log out. Y'all just stand. Y'all just keep where you are. I will just wait for it to expire. Then I will come in back to the same platform. Okay. All right. Okay. All right. So Ho, you take over the host for a while.
Okay.
Yeah, you'll be the host for a while. Okay.
Okay, no problem.
Okay, I'm back.
Welcome back, Dr. Lo.
Okay, come. Can you make me host? Yeah.
Okay, okay.
You click on my photo, then you make host. Yeah. All right. Any other question that been coming in for Sim and Miss Ho?
Dr. Lo, there is one question. Well, yogurt can help constipation.
Okay.
Yeah.
Go ahead.
Waiting for you coming back. So
Okay. Sorry if I say. Okay,
waiting
come.
for boss.
Okay, no, I'm not boss. Okay, come.
Okay. Usually for constipation, yes, no matter you are pregnant or not pregnant, even though the kids less than about 4 to 6 month baby, if we having constipation, yes, we do encourage patient to have a yogurt to ease the sorry, I expired.
Okay. Okay, sorry. All right, you
I get lost a while.
you answer again. Sorry. This is a free.
Okay.
All right.
Yeah, for the constipation, usually there is issue. There is a few factor or few things we ask the mommy or even others having the same problem. We have to tackle in terms of food, probiotic and fiber. Fiber with another name is a prebiotic. Okay. Before that, you have to make sure your free intake is adequate. How do we sure is it? For my common practice, where I ask the mommy or ask the patient or the personnel to check your urine color.
Mm-hmm.
If you didn't have any CKD or renal failure or renal disease, you can check back you are not taking vitamin C supplement. You can check back your urine. Is it the color is clear or slightly yellow? If so, then that means your hydration is adequate. Am I right, Dr. Lo?
Yes, exactly.
And then the other thing is prebiotic or fiber. Is it you're eating enough? In every meal you have means have oat, have whole grain, change your white bread to whole grain bread, and then do you having your vegetable?
Yeah.
In at least lunch and dinner? Do you have your fruits 2 to 3 biji or pieces a day? So that maybe the third issue will be coming is probiotic. Probiotic will help to balance out the microflora in your large intestine or colon. You will try to balance out and make your colon healthier, so that the good microflora will help you in terms of pass motion. So for the yogurt, it contains of high probiotic. But before we buy it, we have to ensure the where they keep it. Is it proper temperature? Or some of the mommy or even the patient, they will try to take the yogurt and put in room temperature. Make it become room temperature, just makan. The issue is we cannot eat the cold thing. This is another issue. When the like yogurt, Vitagen or Yakult, we back to room temperature, the probiotic already bye-bye. Already not functioning. So no point we have that. It's okay to have a cold one.
Okay. So for me, I tell them to be balanced. Okay. If it's hot weather, you take cold. Cold weather, you take a bit warm or hot. Okay. All right. Someone mentioned, I think the Huawei mate. I don't have the name. Just now she mentioned that prune will reduce the constipation. Prune is like fiber, right? Okay.
Yes, fiber.
And then Miss Cole have another excellent question here. is it necessary to consume formula milk during pregnancy, and will it cause high sugar?
Good question. Good
Yeah.
question. We thank God, thanks to the marketing of the pregnant milk formula company.
Okay.
They promote until pregnant mommy tak minum tak boleh. That's
Okay,
the thing.
okay.
Actually, for pregnant, if you are having balanced diet,
Yep.
the pregnancy milk is optional. It might okay. For the pregnant formula, it contains higher energy and higher protein. Since your appetite is pretty good already, crazy good already, always makan already,
Yes,
and then
yes.
you add on for the pregnancy formula will increase your energy intake. It might cause it extra
gain.
or excessive weight gain.
Yep.
That's another problem already. Will it cause high sugar? Might be, because
Might be.
from the diet you already consume adequate for your body to use it, and
Yep.
then you add on for the milk, there will be extra
Yep.
already. It might cause high sugar, yes. If let's say mommy want to have milk to increase the calcium and protein intake, it's good to have like low fat milk. If you having extra weight gain or your weight gain already alarming, low fat. If let's say your weight gain is normal, you might, if you want to opt for full cream or low fat, is okay.
Okay.
Unless you having a weight gain but not significant, then maybe you can try for the pregnant formula.
All right. So usually,
money.
yeah. So for me, usually I will tell ladies, if let's say you are really busy, you couldn't you couldn't you couldn't prepare a proper meal, then maybe you just take 1 cup of milk to have all the energy and the protein you need. If you have the time, you have the time and you have the effort to make a meal, ask your husband to prepare, then you can eat the proper meal, and the milk are optional lah. Okay, that is a very good input from you, Miss Ho. Okay, all right. Thank you. Is there any other question? All right. So
actually, could I add a little bit more on
can.
the fruit?
Go ahead. Yep.
Actually, for fruit, it's not only fiber. Actually, it will increase the iron or the hemoglobin.
Oh, okay.
It might help.
So
okay,
fruit,
other than fruit,
help for the iron as well. All right.
Yes, you just having like a snack to it will help to reduce nausea or as well. If let's say prune is not available in your setting or hardly to have it, you can opt for raisin. Yeah, it might help as well.
Okay.
Okay.
All
Thank you. That's all.
Okay, can you make me host back? Sorry, this is free version.
Okay.
A lot of things need to adjust a bit.
Sure.
Right?
No problem. Okay.
Okay, I'm host already, right? Okay, I try to share this screen. Share.
I give back the platform to you.
Okay, all right, great.
Okay.
Now from the third lady, she is a bit busy at the moment, so she actually pre-recorded this video for me just in case she's busy. All right, this lady is my patient. Her name is Ashley Wong. She's actually a mother of two babies delivered normally in 2 years, and she's a jeweler and also director of Jewelry Direct Factory. Okay, I think she's doing a FB live at the moment, that's why she cannot she cannot be here today, but she have pre-recorded a video about some yoga exercise and what's his thoughts and sharing. Okay, this lady, she actually is a very happy lady and very happy during pregnancy, even though she has some back pain. Okay, every time she come into my clinic, there'll be laughter, and every time before she go also there'll be laughter, even before delivery, after delivery. Okay, so today I will share her sharing with us about the yoga and also her thoughts. Okay.
Hello everyone, I'm Ashley. I'm a mother of two. I just delivered my baby girl 5 months ago. My both babies' age gap is 1.5 years only. I'm very enjoying during my pregnancy. Yeah, I don't have pain here and there, even though sometimes I did, especially came to third trimester, I'll do some stretching so to ease my body so I don't feel pain when the baby is growing big. All right, let me share some of my stretching tips. I hope it helps everyone. Let's start. First, do some simple breathing. Okay, close your eyes. You breathe. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. And relax your whole body. Right? The very first exercise, it's very simple. I know all of you might not do exercise even before you're pregnant, so I'll just share some very simple exercise. The first one, you just do a butterfly pose and hold your both feet and just rotate your body. I love this exercise a lot when I have waist pain. So you just turn anti-clockwise 10 times. Okay, so let's start. 1, slowly. 2, 3, 4, 5, 6, 7, 8, 9, 10. And the other side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, when you open your both legs, you don't need to be open as big as possible, just open, relax. This is very good, my favorite. And you swing, you lift up your hands and you can feel the stretch from your waist, your side muscle. So you just swing like a tree for around 1-2 minutes. Swing and relax. Very good. I very enjoy this. I know it's not easy during your pregnancy, but just enjoy every day like I did. Because you were the queen. You are the queen now. You can do whatever you want. I hope you stretch. You can feel the stretching on your side, yes? Okay. Just relax, and when you feel it's enough, then you stop. You can do every day. Very simple. Okay. The next one, you come up and you open your both legs wide, same length as your shoulder length. When you do this position, you feel better because the gravity, the baby is going down, so you feel better on your waist. So when you breathe in, you pull, you lift up, and you pull your waist up, your butt up. Let the baby go down. Just some light stretch. Breathe in, lift up your head. Then you breathe out, you contract slowly, arch your body. Okay? 1, breathe out. 2, breathe in, breathe out. 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 Okay? Alright. The third exercise, you can do child pose. If you have a bigger baby, you just open wider your leg. Child pose. Just relax and remember to breathe in, breathe out longer. You feel stretch on your both arms as well. Okay. Wow, very good. Feel good. The last one is for waist exercise. You lie down. Okay. Both your legs are open wide, and you lift up the baby up. 1. Slowly go down. Yeah. 2. 3. 4. Put your weight on, use your both legs strength to lift up. 5. 6. 7. 8. 9. 10. Okay. That's it. The pregnancy simple exercise that you can do every day. I hope you enjoy and enjoy your pregnancy. Hi, it's me again. I record another video to share during my pregnancy. I feel the something. It's very important. Doctor, please translate the 腰屈症. I always don't think that pregnancy will have 腰屈症. I don't believe the hormone change and makes you feel sad, this and that. I very enjoy, I stay happy, feel the baby in your stomach. There's only 10 months, you and the baby, the bonding time. Enjoy makan, you want to eat anything you want. For me, I eat everything besides raw meat and alcohol. I drink coffee too, just 1 cup a day. No coffee, no life for me. So even during pregnancy, I took coffee. I took fresh vegetables because I eat a lot of vegetables. Many people say no watermelon, pineapple. I eat everything, okay, but not overeat. You don't take a lot of too much, sederhana can already, agak-agak. So balance the nutritious, eat whatever you want. Don't listen so much of pantang larang. The more you have, you restrict yourself and you feel that 这个不能吃，那个不能吃, this cannot, that cannot do, cannot climb this, cannot do that. I don't listen so much. For me, myself, I just enjoy every day and as normal, and enjoy my husband that pampered me. So this is my own experience. So that's why during these 2 pregnancies, I don't have any pain. Only cry once because the lifestyle changed. I feel hungry every 2 hours. That makes me a bit emotional. Okay, but after that, I just accept and eat, just makan lah. Even the body grow, just let it be and see my changes on my body. During my pregnancy, I gained weight. About first baby is 13 kg, second one is quite fat, almost 16, 18 kg. Doesn't matter, okay? That's a little bit of sharing from me. I hope you too can enjoy. Alright, bye-bye.
Stop share. Okay, so what do y'all think of Miss Ashley's sharing? Can y'all see me? I can't see myself. Okay. Alright, so we have a question here. from E1, his direct message to me, okay? What is the best sleeping position for pregnant lady, especially when the belly is getting bigger? Due to the belly getting bigger, I'm sleeping on side, but my thigh on this side will feel sour and pain. Is it normal? All right. Okay. So basically, Sim, you want to handle this? Is Sim around? Okay. Sim, you want to answer this question?
Yes, for this I understand. Many of my when I go to maternity ward, they also will complain this to me. But what I will suggest them is using the pillow to help to ease the pain. Maybe like just now here say feeling warm, is it, or sour at the thigh area, right? Maybe you can use a bit pillow, but not soft one, but hard one. Not to say hard,
Make up your mind, soft or hard.
It's hard, but still compressible. Okay.
All right.
Okay,
So it's
put
firm
between
firm but
firm.
soft.
Yes, the word
firm.
firm.
Okay.
Put between the thigh. Okay. And maybe because we feel sour, right? So that means sui, is it? Yeah,
Yes,
I think it's sui lah.
A bit cramp
So can bend the knee. Can bend both knee first. Okay, when starting to feel sui already, maybe can straighten one leg first before you change to the other leg. Like that, no? Understand? Because if sleep facing up, definitely is cannot lah.
This is one of
maybe
the.
change.
This is one of most how to say it, a lot of these patients, they always like to ask this question about sleeping. Must it be sideways? So for me, usually I will answer them that you must sleep in a very comfortable way. Okay, because if you're comfortable sleeping sideways, then you sleep sideways. All right. If you're comfortable sleeping on your back, then you sleep on your back. Because I think some of the Facebook telling you that, or if you sleep on the back, it may compress on the vessels, and then the baby have not enough blood supply, then the baby will not do well. No, that one is only during delivery where you have contraction, then the blood flow will be less. When you are not doing the contraction during labor, you can sleep side or on the back. And then if let's say you sleep on the side and you have some cramp, means that your legs are being compressed, and like what Sim said is you need to have something to support it so that you don't press on your thing. So you have a firm support with a pillow, and I think Miss Ho mentioned that you can use a moon pillow. Okay, all right. Okay, is that right? Okay, all right. So let me add Miss Ho in. Okay, another question is for Miss Ho. Okay, Miss Ho appear already. All right, is coconut drink intake during pregnancy really can help to reduce baby jaundice?
Good question. That is common question from mommy during the third trimester. Yeah. Actually, if you're drinking how to say, baby jaundice and your diet before delivered is not much related. It's not so there is a my mom also say that your body is too heaty, and then when you delivered and then baby become jaundice. Actually it's not. Actually it's not. Actually the coconut drink or coconut water before deliver, if you drink too much, actually it might cause you to be having cramp and all those problems during at night time. It's not a must. You like it, you want to take it, no harm. But do more than one glass per day or 200 ml. You want to have it, no problem. Okay.
I think we must understand the jaundice of baby is because of the baby's spleen and liver not mature. So when the baby's red blood cells are not mature and processed, the yellow substance cannot be processed, so it accumulates and become jaundice. So this usually is because the baby has a lot of these red cells, so sometimes they will have more breakdown and more jaundice. So it's totally unrelated to the coconut drink. Okay.
Yes.
Then
actually I would like to add a little bit. Actually there is for pediatrician already. Sorry, my girl's a little bit
It's okay.
too excited.
All right.
Yeah, actually, sorry. For the jaundice, actually, after delivered, if you are baby, you are breastfed baby, try to avoid herbs and any like pale products or herbal products. It might cause the baby jaundice actually.
Yep.
Even though like ginger, I didn't take during my confinement. Yeah.
Okay.
It might cause the baby jaundice actually. Some of the mommy stop the products, stop the ginger intake. The baby getting well after that.
Okay.
Yeah.
The next question is from Miss Ni. Does it necessary to take vitamin C daily?
Okay. If I answer all those like pharmacy and supplement company will kill me. Actually,
maybe I answer. Okay. Actually, this is a very common question. Answer both together,
Yes.
Miss Ni and also Miss Iwan. Iwan also asked, there's one kind of supplement drinks named Millennium. Does it good for pregnant lady to consume? People say good for pregnant lady. Okay. So for me, about this supplement is a big business. Okay. And then whether it's safe or not, usually you need to see the bottle. Is it a KKM issue? Whether it's safe or not. If it's a KKM issue, it say safe, then you can take. But whether it's good or not, usually for me, supplement is an extra things. Okay. So the best thing is like what Miss Ho has mentioned, we need to take a balanced diet, because this balanced diet, this diet that you take, the fruits, vegetables contain vitamin C and all the nutrients that you need, and all these food are it's like created by God, and these supplements are created by humans, and all this you want a fresh thing, you cannot get a bottle or supplement right there fresh in is fresh. If you can get it from the bottle, it's not fresh. If it can spoil, it's not fresh. So if let's say you are really very busy, you couldn't prepare food, you are living in Penang Hill, not much of food to transport up there, then you take your supplement, or you live in a desert, then you take a supplement. Okay, but if you are having a good, fresh fish, fresh veggie, fresh fruits, then supplements are like the milk is extra, so it's extra, yeah. And then for this,
actually, sorry, doctor. For the vitamin C, I just wonder, did you notice that after you taking your vitamin C, what color is your urine? Usually, I ask my, not pregnant mommy, even though my cancer patient, I will ask the patient, what color is your urine?
More orange,
you
right?
pay for, yes, and then you pay 100 for the vitamin C. 500 mg, 1000 mg. But actually, your body only needs the maximum. If you're having like flu, you're getting fever, you need the vitamin C requirement. You increase to 100 mg. If you're taking 500 or even 1000, how much your body absorb?
Yes.
Is it they can absorb 100? I don't think so.
Yeah.
And then actually, you burden your kidney and liver to spread it out.
Yeah. So usually for this supplement, if you take too much, sometimes if it's dangerous, you become toxicity. If you're not, then maybe you burden your kidney, and then the rest is like you're just going to pass out in your urine. I think the recent craze is about this COVID. A lot of people they scared of COVID, they take vitamin C, and even the politician in the Dewan Rakyat lately saying that why are we taking this milk pills when we can use the vitamin C, which is actually vitamin C doesn't going to help you in COVID, okay, but it will help to build better immunity. So if you really want to take vitamin C, you take the natural fresh vitamin C is from the fruits and vegetables. All right?
Yes.
Agree, Miss Ho? All right.
Yes.
Okay. Okay, so all right, so now we have a next comment from Angie. It's a very good sharing, noted with thanks, very good sharing. All right.
Sorry for the doctor for the supplement drink.
Supplement drinks. I answered both things together.
Oh, I answered already. Okay.
Yeah, the Millennium. Okay, Millennium. I do want to comment based on this brand itself, okay. But some supplements, I noticed that when they took it before delivery, during delivery they will bleed more. Means that it makes the blood thinner. So for me, I think better not to take all these extra supplements. Okay, all right. So we got 10 more minutes left. This is the second round of my.
Doctor, I add on a little bit.
Usually
mommy will ask you're taking omega-3 or fish oil during the pregnancy to increase the IQ of the baby. Okay. So usually I would ask the patient to stop it at least 1 or 2 months before your EDD.
Okay.
Okay. I heard from my gynae friends they say will increase the bleeding tendency during delivery.
So far, no increase in bleeding. Because most of my ladies, or actually almost all, starting for 20 weeks, they will start taking fish oil until deliver. So for me, fish oil doesn't actually increase the baby IQ that much, okay? But for our ONG side, the fish oil actually, the function is to reduce preterm delivery, and second is to reduce the high blood pressure during pregnancy. So far I don't see any increase in bleeding.
Okay.
All right. Okay, so before we go, no more question, right? Let me just check the chat box. All right, if no more question, can we all just open up the camera and we take a group photo before we leave?
Okay, we come to the end. If you like this video, hit the like button, hit the subscribe button, and smash the bell, and then share it all away.